An honest conversation about COVID-19. I'm Joe Malone. Joining me from CG Public Health, we have Lionel Foster. Lionel, a lot of people who are not vaccinated have some concerns about the long-term side effects from the vaccine, which are unknown. What would you say to people that have those concerns?
Well, the first thing I would suggest to them is that they get some legitimate medical advice, either from the health department, Sarasota County Health Department, who can give them that information, or their own physician. If they don't have their own physician, certainly the health department can hook them up with those individuals who will give legitimate, honest advice.
Now, what about breakthrough cases, something that we've heard about? Why should we care about getting vaccinated if we can still catch the virus even after being fully vaccinated?
Well, I think a lot of folks think that there's a cure. The vaccine is not a cure. It takes the fangs off of the virus when it infects someone. It keeps individuals from becoming seriously ill or even dying from whatever the cause that hits them. Most of these vaccines will prevent that, or at least lessen the impact of it. And so we recommend that they get vaccinated.
Now, the CDC recently reversed course on masking among the fully vaccinated. Why should I get vaccinated if I'm just going to have to wear a mask anyways?
To be honest with you, the system has not come out and told us, at least in my impression, that the vaccine is not going to prevent you from getting, it lessens the impact if you get hit by the virus. So if you are wearing a mask and you are vaccinated, you are doubling your chances of not getting the new virus that's out on the market. And as these viruses continue to mutate, we're going to see more and more of it. And the less those folks who don't get vaccinated are going to suffer a lot more than the folks who are vaccinated, if that makes sense.
Now, the vaccine has been shown to cause, in some cases, heart inflammation in young adults, other side effects as well. What would you say to those fearful of the side effects of the vaccine?
There are some side effects. I think the side effects that's been talked about most are young people who have developed a inflammation of, I call the heart. There have been, I think, 323 cases of heart inflammation caused by, I believe you pronounce it, myocarditis, if that's pronounced right, for individuals from 12 years of age to 39. I recommend to, and I'm sure the health department would also, that individuals who are concerned about that should talk to a treating physician. Ask their own physician particularly if they have a particular heart issue and find out whether or not they should take the vaccine.
Preexisting condition.
Preexisting condition.
Now, let's say I want to get vaccinated now. What should I know about?
Well, you should know it's free. Also, if you don't have transportation, the health department can get transportation to wherever you want to go. Individuals 12 years of age and older can get the vaccine now. And I don't know what else we can say, except if we don't continue to get vaccinated, or the public doesn't continue to get vaccinated, the virus is going to continue to swirl around us, and we could be here forever doing this. Every year, as the flu comes in, we could have a new virus comes in, and at some point, they're going to have to come back with another vaccine to fight off the mutation of the next COVID that comes around.
Lionel Foster, thank you.
Thank you.
Having an honest conversation about COVID-19. If you have questions about COVID-19 and vaccines, reach out to your healthcare provider and to CG Public Health at cghealth.com.